Okay, so we will discuss about a little bit about the preparation and everything. Okay,
Okay.
so yeah, actually, I want to give a proper guidance because the last minute preparation is very important, right? And this last minute preparation, actually, the main thing is you should actually focus on high yield topics. High yield topics, right? You all know what are the high yield topics. So, as example, when we talk about the cardiovascular diseases, we have acute coronary syndrome, heart failure, right? I will share a high yield topic list as well because I already made that file in our main group file section. So you have to focus mainly on high yield systems only, okay? Like if we have so much we have a huge uh, guidelines and like so much capacity for the AMC, but in this last few days actually it's better to follow the high yield topics. Okay, please remember because we don't have time to follow everything in this. I think we have only 22 days, right, doctors? From tomorrow
Yes.
22 days, right? So better to use
Yes.
these 22 days like properly because you don't have much time. And uh, actually you should do actually 30 to 50 questions per day because I'm telling you to do these 30 to 50 questions per day because you can revise through questions, then you will remember it clearly, right? Because we have a good resource like e-medicine, so you can do this as example. If you want to revise the heart failure, better to go through some e-medicine question, and then you can identify your mistakes and go through that short and sweetly. You are not as well, okay? So that's how we should prepare in these things, okay? Doctors, give me 1 minute.
Yes.
Okay, so that's how we should manage to revise. Okay, usually mainly from the questions. Okay, I'm just telling because I also use the same method. Okay, then you should have a pattern of recognition and everything. Like in each question they have mentioned specific points, like in that case first of all we have to usually they ask in management investigation and everything, right? In that case you should identify the pattern mean, as example, if this situation is acute or chronic. Okay, so if the patient is stable or unstable, especially we have to check the blood pressure. That's the main component that we can check the patient is stable or unstable, right? And
Yes.
you should know the red flags and each and everything. So you should know the pattern, right? Otherwise, if you just only revise your theory and you haven't done enough MCQs, you can't identify the pattern, right? Even I was doing my theory sessions, I always telling you, once you are reading the question in your mind, it's automatically confirm this stages. This is like, oh, this is accurate situation. And while you are reading the question, okay, not after reading, while you are reading question, you have to get an idea about this patient, okay? Yeah, then you should know the you have to, if you can't find any options clearly, like you are not sure about the answer, okay, but you can understand the question, in that case better to use the exclusion criteria, doctor. Exclusion criteria, right? I'll share some small PDF I have made and include everything like stepwise, how you should follow and approach this last minute preparation. And You know about the ethics and professionalism questions, right? These are easy marks, right? If you know the concept clearly, you can easily answer. Like when you are doing the ethics, okay, please remember, for AMC, ethics is very high yield thing, okay? You should pass ethics, okay? So always think patient safety comes first. If you have no idea about the no idea about that theory point, okay, but you should keep in your mind when you see the ethics questions, always patient safety comes first. So if you don't know the answer, you can think according to this path. They always patient safety comes first, okay. Yeah, then okay, then the for final 10 days, right? In those days, please don't take any new topics or new notes or don't watch new videos, okay? Always try to revise your familiar guidelines, familiar notes, everything that familiar to you, okay? But don't waste time to read new things like new topics, okay? Because this confidence come from the this familiarity, right? Like it's actually easy to go through your previous notes rather than reading a new note, right? That's what I'm telling, so you have to think about it. Okay, 1 minute, it's our recording. Yeah, it's our session is recording or not? Okay, it's recording, right, doctor? See, I can't see because yeah, it's recording. Otherwise, because only 7 doctors are here, anyway, I have to help other doctors as well, right? Yeah. Then, so please thoroughly remember in final 10 days, okay, you have to do the like revise your own topics, mean from your notes and familiar guidelines. Okay, don't go to touch new things because that can increase the anxiety, right? Yeah, that's the thing for final 10 days. And before your exam, doctor, in final 10 days, actually better if you can practice the mock exams, but don't think about the mock exam result, okay? It doesn't count your exam result. Use mock exam only to get a proper time management, okay? That's the main thing to do in the mock exam. Okay, then yeah, so what about exam week? Exam week guidance. So, what we should do during the exam week? Tell me what we should do during the exam week, doctors.
Focus on recalls.
Yeah, yeah. So, in exam week, okay, you should only focus only exam week topics only. Don't even think about another topic other than exam week recalls. Okay, don't waste at least 1 minute for other topics. Only focus on exam week topics. Okay, um, in during the exam week, stop chasing new contents, okay, like new topics, new notes, or new videos. Revise only exam week recall topics. Please remember this one, okay? Yeah, because if you're like going to understand new topics or new scenario during the exam week, that can increase your anxiety, right? Because exam week is a very intense moment, right? In okay, as example, if you are doing exam in day 4 or 5 and the beginning of the Monday, how you should feel. You feel so anxiety, right? You're waiting for what are the topics that repeat in this February exam month, like how hard the exam is in day one, then day two, like that. Anyway, you're already in a like big stress, right? You're already intense, so in that case, please do not try to understand new topics or new concepts. Okay, so only focus exam week recall topics. As example, okay, you will get questions in day one. Some recall questions from pneumothorax, then heart failure. Okay, then hypothyroidism. Then the only thing you should do this during this. Okay, this is day one questions, and please take a pen and paper and note down day one, and please write down the topic list. Okay, don't memorize the recall, just write down the topic. As example, you get a question from heart failure, then write down heart failure. In the same day, you have to revise the heart failure. That means you should know how heart failure present, what are the classification of heart failure. Then you should know how we should diagnose heart failure, and then you should know what are the treatment and what are the exclusion. Like as example, uh, yeah, to give beta blockers, patients should be euvolemic. Okay, like that, you should know the key points. And in November exam, they have uh, give some key points from that TG heart failure chart. I have explained from my heart failure topics. If you are new to this group, please, doctor, go and check the cardiovascular system topics that we already covered in December. Okay, I have explained everything from the guideline. Okay, in December, in as I remember, we got some questions from heart failure, and in the day five, they got the we sorry I got actually I got that question, the same heart failure question, but they are not asking about the initial management. In that case, they have given heart failure with ejection fraction. Okay, okay. They already started the heart failure for drugs, and still patient have not improved the ejection fraction as less than 30 or 40. Yeah, 30, I think. So in that case, what we should do in the therapeutic guideline, in that heart failure chart, they have clearly mentioned. Okay, they have
That's
clearly
so true.
yeah, they have clearly mentioned if the ARBO ACE uh, not working and still not increase the ejection fraction, then you have to change this ACE inhibitors or ARBs to uh, sacubitril or RNAs, right? Sacubitril. So that's how you should revise theory topic during the exam. You should know the concepts. Okay, yeah, because even in day one, they can ask what is the initial management. That's for drugs. Okay, but in day four, day five, they are not asking the same thing. Usually, they are twisting the question. They want to know that you should know the actual guideline points. Okay, if you are like revising only the question, like you saw heart failure question or the initial management, or you know that four drugs, and you are not touching the you are not going through the heart failure full topic. Okay, in that case, how you should answer, even though you know the topic, you can't answer, right? So 1 minute. Yeah, okay. So that's what I'm telling you to the exam week recalls. You should go through the whole topic, right? Because you are not that the exam week recalls mean you already done that topics, right? So in that case, you have to go through the important points and concepts, right? Yeah, that's how we should answer. We should prepare for the during exam week. So main thing, recalls only, the recall topics only, not just the question, the topics only. Okay, yeah. Then what is your daily routine should be in your exam week? What is your daily routine? Actually, doctor, I'm just telling this, the good sleep hygiene is mandatory during the exam week. Okay, because like you have to maintain your sleep pattern, right? You have to maintain your sleep pattern, but not much sleep. At least you should take at least 5 hours of sleep, right? You should need to focus, you should need to concentrate, right? For that you need a clear mind, right? Because if you are doing exam in day 4 or day 5, and you are not sleeping from day 1, and you have only 2 hours sleep each day, and you will be exhausted in your exam day, right? So good sleep hygiene also mandatory during your exam week, okay? And you should revise all the recalled topics. I'm telling the topics, okay? Not memorizing the questions. It's actually better, anyway, you go through the questions anyway. But please don't forget to revise the topics, not just a few topics. You have to revise all the recalled topics, okay? I'm just telling you, you should revise all the recalled topics. Because if you are doing exam in day 4 or day 5, you will have a bunch of recall topics. In each day you have to cover each recalls topic, okay? Don't take too much, just go through the topic. Yeah. And do not memorize questions and answers, because AMC will not give the exact same question, okay? They are not giving the exact same question, because AMC is smart, right? Like, they are not giving the same question. Yeah, if you memorize this question and the option, you will anyhow anyway feel confused during your exam, in the change of setting the stem, right? So you should be smarter too. In that case, you have to understand the core topic behind the each recall, and you should know the guidelines and not the old guideline, just updated one, okay? Then approach and the reasoning behind each recall, okay? Because if you know the topic, you can answer, right? No matter what they ask, you know the topic. You have the biggest advantage in doing later days, right? Because you will have a list of recall questions, and you can prepare them, right? Yeah. Then what is the exam day strategies, doctors? What are the exam days strategies? So the main thing in exam day, the first rule, I'm telling this from my experience, okay, doctor. The first thing you should do is stay calm during your exam, because this exam is, we know, very expensive exam. And everyone is like having some like dreaming of doing jobs in Australia, and maybe their partners are doing work in Australia, so they have like so much dreams, goals in their mind, right? And this is like a life changing situation, and anyway you feel so stressed, right, in during the exam day, right? So in that case, it's okay to feel like unsure and uncertainty, but the main thing, you should be calm during that day, because confidence comes from control, okay? Yeah, you have to control your mind, you have to control your anxiety, okay? And you should remember this thing properly. You don't need to know everything to pass exam. Please keep this in mind, okay? No one needs to know everything about AMC, okay? Because it has a vast area, right? No one know everything. So you need to think calmly and recognize the question and choose the safe option. And you have to move forward with confidently, right? And you should trust your preparation, because no one is able to know everything about AMC, right? Yeah. Have you ever know like who is getting like 500 out of these 500 mark? No, right? So that's how AMC works. But you can pass, okay? You need to get 250, right, to pass. So in that case, please remember, you don't need to know everything. We just need to know specific as a actually you should need to know mainly when for the for during your recall during your exam week the recall topics, and you already done like so much hard work to remember other topics as well. Eventually they will remember, but mainly focus on recall week topics during the exam week. Okay. And this method is actually okay. I'm telling a specific way to read the question. I don't know if you have specific method. That's okay. You can just give it a try, because when you read the question like this, it will be easy you to manage the time. Okay, you can read the last line first, right? Like what they are asking. They're asking like most appropriate next step, or what is the gold standard investigation, or what we should do next, what is the initial investigation, or how we should confirm this patient, like that. This is a good method. I use this. Okay, you can just read that last option, what they are asking, then read that, then keep in your mind, then you can read the question. And while reading the question in your mind, you already have what they are asking, right? And while reading the question, you should give like special attention to the age, patient's stability, and what is the patient's setting. Is it a acute scenario or emergency case, or like that? You have to think like that. Okay. I think this method will like save your time, because you have a something, you have a goal in your mind what they are asking, and you have the question, and you can like while reading the question you can get an answer in your head, right? Then you can read the options, and that will save some time. Okay, but I'm not telling you this method. Okay, I'm just telling this will help. You can just give it a try. Okay, that's all. Then, and I'm just talking about during the exam. Okay, during the exam, then you should choose the safest option. If you have some confusion, as I always say, use the exclusion criteria. Okay, just think why we can exclude this and why this is not the option. So in that case, uh, you will find a one answer that after excluding other options. So in that case, you can choose that answer. And the main thing, please remember, the most important thing is the time management, right? The time management. So have you prepared time management for your exam? Have you is anyone is having a like time preparation for the exam, like in this minute I should cover this much topics, like that? Is
No,
anyone?
no, no, Dr. Sithara.
Yeah,
I'm
okay.
particularly interested in that time management.
Yeah, okay. But the main thing I will show, okay? So you should remember the time manage. I'll share this PDF, okay? I have made especially for you to guide you, okay? Because
Thank
you,
you.
yeah, no worries, doctor. So you should
Thank you so
actually,
much.
please do not take, I'll share this, okay? Do not take more than 1 minute for each question. Please, okay? Do not take more than 1 minute for each question. And if you are unsure, okay, if you're unsure, you can like you can eliminate the wrong option from the exclusion method, and you have to pick the remaining, and never let one question steal the time for more easy ones, right? If taking time for unsure question, like if you are taking 3 minutes for unsure question and you still know the you don't know the answer, and it will eventually take your time from the questions that you actually know. So the one question is not decide your exam score, right? So in that case, please don't be confused or take more time for one question. And okay, so the same thing I have here to mention, the mental health on the exam day. Okay, because
Hello?
during
Sorry.
the, yeah, doctor.
Yeah, sorry to interrupt. Is it possible to come back to a question after passing it?
No, doctor, you can't. If you mark the answer and you move to the next question, you can't come back. Okay.
Okay.
Yeah.
Okay.
And okay, let's little bit discuss about the mental health during the exam. Okay, I have here at main thing, the most important one is do not panic during the exam. You should not panic during the exam week as well, but during the exam, the mail you should remember, do not panic. Why? Okay, if you panic, like as example, I'm just telling from my experience, doctor. Okay, because if you saw some a new question and you feel panic and your heart rate and everything increase and you feel like you can't concentrate, right? You can't calm down in that case. So that's why I'm telling you, if there is a like uncertain question, you should not be panic, right? Because one question uh, doesn't sorry one question doesn't make you a score, right? Doesn't make you fail. Okay, so in that case, and if you like, I can tell, yeah, because even though I'm telling you to not panic, sometimes you can panic during the exam. In that case, please please remember this. Take like you have to pause for the few seconds and take a slow breath. Okay, and remind yourself that one question does not decide your result. Okay, please always keep this in your mind while doing your exam, because the mindset during the exam is the key thing to pass. Okay, if you panic, you can't pass this exam. Okay, if you like, if you are so confident, if you know everything, that doesn't matter. If you panic during the exam, you can't concentrate, right? You can't get the proper answer. So in that case, please always remind yourself this. Okay, because calm thinking is the biggest strength in AMC. Because most doctors have failed this exam, not because they have a less knowledge. They have enough knowledge. The only thing is the exam anxiety during the exam. Okay, so that's why I am telling. And you should manage your time to reduce anxiety. Okay, and please remember, during the exam, the time start from 210 minutes and it's going backward, like it is countdown system. So 210, 209, 208, like that, time is going backward, not in hours. It's in minutes. Okay, like that. And the questions numbers, like we should the question numbers are going forward, like okay, when time is 210, the starting point, you are doing question 1, right? Question 1. And okay, so in because of that, this because of that, you should remember, you should have a you should have a like time management plan during your exam. And you should know, before going to your exam, uh, you will receive some like whiteboard, not the exact whiteboard, the paper, like laminated paper with a marker pen. Okay, in that case, please when, like after you sitting down for the exam in front of your exam computer, please make a pen, make this marker pen, and write down this one. Okay, I'll show what you should write down, because the time management is very important. Because during the exam, okay, as an example, if you are in the time 150, and if you see the time, in the screen, and you can suddenly panic, like you can't calculate the time, how much I should finish for now. You don't have time for the calculate this time. Okay, in that case, you have to remember something like, in 90 minutes I should finish 90 questions, like that. Okay, so that's what I'm telling this. And and always you should know how much time is left and how much question you have to finish. It's very important, doctors. Okay, and good time management is the best way to avoid exam stress. I'm telling from my experience, doctor. Please trust me. This is very important. Okay, and you should not spend too long in one questions. If you are unsure, do not fight with the question. Just mark using exclusion criteria and just move on. Okay, because you have more questions to go. If you wait like more than 3 minutes for one question, not sorry, no more than 3 minutes, I mean the more than 1 minute for the one question, it will eventually decrease the time for your questions, that you can like have a good idea, you have a good proper theory. So eventually you can't um, you can't mark them. You don't have enough time for the good questions, right? That's what I'm doing. So here's the time management I use during my preparation. Okay, so after sitting down in front of my computer, I quickly get the pen, get mark pen, and make this kind of line. Okay, then marked 210, 180, 150, 120, 90, 45, and 0. And in 180 minutes, okay, when screen show the time as 180, I should be covered 23 questions. Then the time shows the 150, I should cover 45 questions. When time is 120, I should cover I should have covered 68 questions, and 90 I should cover 90 questions. And if it is 45 minutes, 120 questions, and last 45 minutes for other 30 questions. So this is how I used my time management. You can just practice, take a pen and paper and mark this line, and you can write this 1 times per day. Then you will eventually remember the number of questions, and you can make your own one. This is my one. I used during my preparation. Okay, and I'm just telling from my experience, when my time is 180, I have covered 28 questions. Okay, then I felt so good, and I feel so much like I feel so good, and I was so calm, and I was chill, because in during the exam we are stressed. And when I can finish more questions than in this the management plan, you will feel some like good feeling, right? Then it also can help you to focus in future, like in next questions. Because like I don't know how I can explain that feeling. If you're like if you finish more questions than your plan, then you will feel so good, doctor. Then you can like happily answer other questions, because you know you have enough time, right? Yeah, like that. Yeah. So please make your own time plan, or you can use this one as well. Okay, but you can't keep this in your mind due to the exam stress and the intense feeling during that. You should write down this. Please write down this. Okay, because otherwise you can't remember this thing due to the you can't calculate. So before starting the exam, please write down this one. Okay, then you can check the timer, and you can check the questions, and you will be fine. Okay, then yeah, the same thing. Then other things, the same thing I have mentioned here. And one more thing you should remember during your exam: you should not carry one question to the next one. Okay, like if you mark some answer and if you still thinking about it, oh, this might be wrong, I think I'm losing mark, that eventually affect your next question. Okay, so if you marked answer and you moved forward, you can't change it back. Keep that thing apart from your new question. Okay, so you have to move forward. So please remember these things. These are the key things that you should follow during your exam. Okay, yeah, because each question is a new opportunity. Your performance improve when your mind stay in the present, right? Yeah. And yeah, the main thing, you should be so kind to yourself, right? Because I know every doctor who is doing AMC exam is doing so much hard work, right? This exam is not easy. So you should trust your preparation, and it's okay. Like now, I know you can feel like I have forgotten everything, and I'm not sure about my preparation, but don't think like that. Please trust your preparation and do hard work and revise each topic, especially recalls. Okay, because if you're familiar with recalls, you should know how recalls are repeated here. Even some doctors are here in my from my recall classes, and they know how recalls are appearing in the exam, in next exam, right? We have done October recalls, and in October recalls, most of topics are repeated in November exam. Like most of topics are repeated in November exam, so that's why the recall is also very important to identify how you should approach the question and what they can ask in the exam. Okay, so yeah, that's all for the exam preparation. Okay,
Thank you very much, Dr. Sithara.
yeah, I hope you will get a good guidance and everything. What is in the chat? Me too, doctor. I finish with 50 minutes more time remaining. Yeah, doctor. And one more thing I have to tell you: in the exam week, you should not. Okay, because exam week we have recall classes, even paid or free any classes, because we are taking recalls from the doctors who appeared in exam, right? They are not exact question, and we are getting like half questions, and sometimes the most of important points can be missing, right, in those questions. And in the recall classes, paid or free recall classes, in their marking most answers according to that stem only. The ones the recallers applied the only this incompleted stems only. But in exam, you will get the proper clear question. So in the exam, you should not mark exact answer that mark during the exam week recall classes. Okay, you should know the topic clearly, and you should read the question properly, and you should mark this answer according to your knowledge. Okay, not from that marked answer, because recalls are not exact question. Okay, recalls are the questions that doctors remember from the out of 150 questions, and they are giving I got this question, and I can't remember other part, like that, just recalls. Okay, so you have to trust the topic, not the recall. So in that case, you should read properly and answer properly. Don't follow the answer. Like you can as example, if you see a question, okay, I did in this recall session and they have marked like this. So don't do that, okay? Even though the beginning of the question can be same, but in the stem they have changed something, okay? In that case, you should read the question carefully and don't depend on the exam recall marked answer, okay? So I'm telling you because uh, if I marked the exact marked answer from the exam week records, then I will be failed, doctors. Okay? Because you have to think properly. Okay? Think properly, and you should always cover the exam week topics, not the question. Do not memorize the question, memorize the topic. Okay? That's the most important part. So I feel I feel you will understand everything, and if you have any questions regarding exam preparation and everything, please you are free to ask anything. Just ask me.
Uh, None for now.
No.
Yeah, doctor.
None
How
for
you
now.
feel?
Hello?
The time management suggestion was very helpful. Thank you.
Yeah,
I'll
it's
try to see
very
how I can work with it. Yes.
yeah, doctor. You have 22 days. If you like not comfortable with this timeline, please like you can't remember this. Write down every day. Take a pen and mark a line. Then write down this. And after like in the and one more thing I have to tell in e-medicine mock exams. I don't know now. In previously, they have mentioned the time from hours. Like the time is going back from hours, like 3.5 hours like that, but in exam it's exactly from minutes, okay? So
Minutes.
if you are doing mock exams in e-medicine, please download some. I think you can use some. YouTube has, you can type 210 minutes countdown clock from the YouTube, and you can split the
Okay.
screen. Yeah, you can. I did that. You can split the screen because in e-medicine questions, once I was doing, they have mentioned it from the hours, okay? So you can
It's more
split the,
difficult.
yeah,
It's more
because
difficult to
then
follow.
yeah, then you don't get a proper idea about this how
Yes.
this minutes going back. So you can split the screen. In one side you have the video countdown from 210, and you have the questions in this side, so you can manage. And while doing the before doing the mock exam, write down that time management plan. And when you are like doing the questions, and please check the answers, like not the answers, check the questions, like in 90 minutes. Oh, I should finish 90 questions, then I will have enough time, like that, okay? Then
Okay.
you will feel calm during the your exam, okay? Yeah, that's what I'm telling. So follow these things, and you can just watch my theory videos if you have any doubts. And but please don't take much more time for like one topic, because you don't have that much time. So you should quickly go through everything, okay? Yeah. Yeah, doctors,
Thank
that's
you.
all for the exam preparation
Yeah.
guidance. And
Dr.
Thank you
Sithara,
very much,
please, can
Dr.
I
yeah,
Sarah.
ask,
Very,
have you been able to
hello?
upload the IU topics you took on your YouTube?
what doctor, which topic?
I know I'm asking if you have now been able to upload all the IE you took. Have you been able to upload all of them now?
Yeah, doctor, I'll upload. Yeah, I will upload. Tomorrow I have a free day, so I'll upload everything. Okay? Yeah, thank
Okay,
you.
okay,
Yeah, doctor.
okay. Because your notes are very
Yeah.
helpful. They are
Yeah.
very authentic. I'm confident that once I've read the book, I don't need to go elsewhere to look for additional information. So if you can,
Yeah,
please
yeah, and one more
upload.
thing, like, when is your exam day? Like, is it a day,
Mine is on Friday. On
Friday? Yeah,
Friday.
that's good.
Yes.
Please book your exam on later dates, because that also will affect your AMC result. Okay, you need these recalls because some months they are giving like weird questions. As example, in October, the questions were very weird, and most of the doctors who passed AMC was done the exam in day 5 and day 6. I haven't get any response from the doctors who did in day 1, 2, or 3. Okay, so in that case, I'm telling, please do your exam on later dates. At least book the day fourth, okay? Because then only you will get enough amount of recalls. Because we don't know, some months AMC like so crazy, right? They are giving like so much weird topics and weird questions. So we never know, right? So we can't predict anything. So in that case, we have to make the precautions. That's what I'm telling you, to book the later day. Then we will have at least the topics that they are asking. Even though questions are weird, we know the topic, so we can clearly prepare for that, right? Yeah, that's all, doctors.
Yes. Thank you very much
Yeah.
again, Dr.
Thank
Sithara.
you so much, doctors, and I wish you all the best. And if you have any doubts, please ask in the group. I saw some, you have shared some recall questions. I will answer because I was quite busy with October recalls, because October recalls are very weird, and it will usually, my recall class period were like actually the 10 days, but for the October I have to do the extra day as well, because in some questions we had to take like 1 hour to explain that question. That's what I was so busy. But don't worry, in next week I will be give more priority to February, doctors, and I will help as much as I can. Okay, and thank you so much, doctors, for joining today. Yeah.
Thank you.
Thank you
Thank
so
you
much,
for
Yeah,
your time.
Dr. Sithara.
thank you so
Sorry, I
much.
have a question.
Yeah, doctor.
Yeah, there are some, I don't know if I call it, some reports that the actual exam questions are not as long as those in image. Please, what's your experience?
Sorry, doctor. Can you? I didn't get the question. I didn't hear you properly.
Yeah, okay. The details provided in the questions and the length of the question in image,
Yeah. Okay.
especially the mock, yes. Are the
Yeah, yeah,
exams as long as that or shorter?
yeah. During the exam, we have long questions and short questions as well, doctor. Uh, in norm exam, I have noticed even my exam was mostly e-medicine questions. Okay, e-medicine questions. Uh, because they have like included that part. You have see the emails question how differently, like WBC, and after the question they have mentioned the little part like WBC like that, red blood cells count like that, separately. So I got those kind of questions. Yeah, and the I did on day 5. So I got both short questions and long questions. Okay,
Okay.
so it's depend on the situation, doctor, but not all the long questions like that. You will get the mixed question pattern.
Okay.
Yeah.
Okay.
Okay. Thank you
Okay.
very much.
Thank you.
Yeah. Thank you
Thank
so much, doctors.
Thank you.
Thank you. Okay, and bye bye, doctors. Have a good day.
Yeah,
And
bye.
you can
Thank you, Dr.
join my
Sithara. Bye.
free recall not free free theory session. Today we are covering screening topics. That's a very high and easy marks. Okay, so please
Okay.
try to join, doctor. I'll conduct it on 10 p.m. Australian time. Okay. Yeah, and
Okay.
Okay.
yeah, thank you
Yeah.
so much, doctors. I'll upload this video.
Are you going to share? Oh, yeah. Are you going to share the file in the
Yeah, doctor,
February group?
I will share after the session. Okay. Now I'm going to
Okay.
finish the session and I will share it. Okay. And
All
yeah,
right. Okay.
yeah.
Thank
Thank you
you.
so
Thank
Thank
much,
you
you.
very much.
doctors. Yeah. Bye
Yeah.
bye.
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 Bye.